Hello, America. My name is Darren Gardner. The other night in Chester, Virginia, I attended a town hall put on by the www.myobama.com campaign. It was put on by the Virginia Interfaith Center, and on their brochure it says Unite for Social Justice. This is a far-left organization, and we asked a simple question in regard to the health reform bill number 3200 that's in the House. And it was about small businesses and how they will be taxed if they choose not to provide insurance to their employees, or on the individual, how they would be taxed also. Watch this video and you tell me if you think that what's happening is fair.
We have a question about small businesses. How about the small business community? What choices will we have? I heard that we'll be taxed if we don't provide or if we don't offer health care after health reform.
Okay. Under the House bill is the only is the one that I will refer to in this question. Under the House bill, small businesses with fewer than 10 employees will be eligible to enter into the health insurance exchange, so that small businesses would be able to purchase insurance for their workers through the health insurance exchange. So that's something that will help some small business, and in the second year it would be up to 20 employees, and then they hope to increase the eligibility to the exchange going forward. Now, as far as a tax on small businesses, there would be a payroll tax for small businesses who did not offer health insurance coverage. But that surcharge would only begin on small businesses with payrolls over $500,000 a year. So for small businesses, very small businesses with payrolls under $500,000 a year, they would not be subject to any sort of tax. Over $500,000 a year, the tax would begin at, I believe, 2% of payroll. So the employer would have to pay the equivalent of 2% of payroll in a penalty, a tax, if they didn't offer health insurance coverage. That would max out at, I believe, $750,000, payrolls of $750,000 or more, and that would be an 8% payroll tax, and that would stay flat going up. So for small businesses that are sort of really small businesses, they would largely be exempt. It would have a new option to purchase coverage for their employees, but there would be a payroll tax for some small businesses in the current proposal.
And actually, there was a recent survey that was released. There's a blurb about it in the Richmond Times-Dispatch that even if they do fall in the category where they get the 2% charge, that's still a smaller chunk of the payroll tax than if they provide health care. Like the survey showed that the smallest businesses were paying 10%, or at the lowest, like 7% of their payroll. So that's still smaller than they'd have to pay if they did offer.
But that doesn't provide them an option. That's saying that they're going to be taxed if they choose not to have the insurance.
Under the House bill,
that's the way the House bill reads.
The House bill, because the House bill essentially has an employer mandate. So all employers are required to offer would be required to offer health insurance coverage, or they would face some sort of a tax. But as Ali said, that tax would likely, I mean, while they want to make it so that it's more beneficial for them to offer health insurance coverage, it probably would be
But it's still not a choice that they would have to do that. This bill is called Health Choice of 2009. That's not giving that employer a choice. You're saying it's mandated, which means that they're forced to do that. That's not right.
Well, they're not. Well,
from a small business perspective, that's not right.
Tax.
You're paying the tax is what I'm getting at.
Yeah.
You're being forced to pay a tax. This is not a choice for the small businessman. This is what is being forced upon the small businessman, additional taxes. Why does he want to provide that? What if he wanted to just pay his employees more, let them get their own insurance? what would happen then? He would still get taxed. That's wrong.
The next
Correct?
question-
I mean, that's certainly, I mean, I can see that perspective.
We should have a choice. If it's going to be called a Health Choice Act, we should have a choice as a small business to make a choice whether we want to have it or we don't want to have it. Correct?
the
Would you
next-
not agree to that?
All right, let's move on to the next question.
Well, wait a minute. I just want to hear his final
Well, I mean,
perspective.
but I would say that the other side of that is that you essentially do have a choice whether to provide it or not. But,
No, you don't.
But I mean,
Not if they're
Hold on,
taxing
I don't
you.
want to start an argument here.
No, we're
He asked a question about a bill.
I'm not
He posed the
arguing.
question, and he answered it.
I'm not arguing. I'm just
There is an
asking the
employer
question.
mandate in the House version of the bill.
So what do you think? Not only did they not answer my question, or didn't want to debate my question, they actually said that I tried to say that I was starting an argument. Well, I disapprove in that. In House Bill 3200, right here on page 167, it says tax on individuals without acceptable health care coverage. And your tax will be imposed in the case of any individual who does not meet the requirements of subsection D at any time during the taxable year. There is hereby imposed a tax of 2.5%. Now, it's right here in the bill. Read the bill, page 167. They call it a Health Choices Act of 2009. No choice here at all, America. This is socialism.